Minister make an initial statement.
Okay, thank you, Fiona. And I know that this is an area that you're very familiar with, as it is in your own constituency as well. I thank the Minister for being here in relation to this. I note that the Minister for Health, Simon Harris, visited Naas Hospital recently, and that was through social media and newspapers. Excuse me, I rushed to get here. And I think it's regrettable that other TDs in the constituencies were not invited to that, because it always was a matter of respect and courtesy before that all Oireachtas members in a constituency would be invited to meet a government minister and to air the issues that they had. And I think, not just in this case, but because I'm speaking about that in relation to Naas, that it was regrettable that it didn't happen, particularly because I have raised the issue of Lakeview before in this House with the Minister. Having said that, just getting to the topic in question. Lakeview is a 29-bed unit in Naas Hospital, and the staff are absolutely fantastic. They do an incredible job with people who have acute mental health issues. Not a day goes by in this House that some member does not speak about mental health and about the importance of it. And I know that you're very conscious of it yourself, Minister. This is an absolutely crisis situation in Naas. It is, and having spoken to the HSE, they acknowledge and recognise that this is the top priority in the country for funding. To have a 29-bed unit in archaic conditions, mixed wards, which certainly does not help anybody who is in a crisis situation with their own mental health, is absolutely appalling in this day and age. And at this point in time, because a lot of patients cannot be catered for there, they have to go up to the 10-bed unit, which is in Portlaoise, and it's putting pressure on that unit as well too. There is a huge need for an investment of, I would say, €5.5 million to be spent on Lakeview, to make it a modern place, to have a positive environment for people who are suffering from acute mental health issues, and to help restore confidence in the system there. I believe that there's a huge burnout among the staff there because it's dark, because it's dreary, because no investment has been put into it, I would say, for over 100 years. While community mental health support is vitally important, and any actions that we can take to place an emphasis on positive mental health, when people present with conditions that they need to be in a safe and secure unit, it's imperative at that point in time that they are in the proper place and receive the proper care. At this point in time, the investment in mental health in Kildare is the lowest in the country. We have one of the highest rates of suicide in the country. Over the last 10 years, there have been an average of 23 suicides within County Kildare, and most of them would be from my town in Newbridge. In fact, over the last 2 months, we have had 5 suicides there. We need to have a situation where people can present in an emergency A&E situation for mental health issues, because at this point in time people are presenting in our A&E within Naas Hospital, which is just across from the corridor, you could essentially say, from Lakeview. So we need to put emergency measures in place, and we need to have a positive environment for those who are suffering from acute mental health issues. Thank you, Minister.
Thank you.
Thank you. Just to thank the Deputy for raising this issue, and I suppose as Minister, but particularly as a TD who is from a county as well that is probably one of equally the lowest funded in mental health. I understand where you're coming from. Lakeview, as you've rightly said, is a 29-bed acute mental health unit on the campus of Naas General Hospital. It was designed and built in the late 1980s to cater for the Kildare West Wicklow population of 135,000 at the time. It succeeded the previous arrangement of services provided provided by the Carlow and the St Lomans Dublin Mental Health Services to the population of Kildare, and was a groundbreaking at the time development based on the national policy then, which was planning for the future. Some 30 years on, the current population of Kildare West Wicklow has increased dramatically. It's now at 228,000, and obviously that's expected to rise over the coming years. Increased pressures on both bed occupancy and levels of acuity have created, as the Deputy has pointed out, a very high-risk environment for both the patients and obviously for the staff. The HSE indicate that the number of beds in Lakeview is inadequate for the current needs of the area based on the National Policy of Vision for Change, and I think the occupancy rates of 140% provide even further evidence of that increase in demand and obvious need. A temporary accommodation, again as the Deputy has pointed, was reached 3 years ago, with 10 acute beds being made available in the acute unit Portlaoise for Kildare patients. However, this is not ideal by any means. The numbers remain, however, inadequate, and the demand and pressure on the Naas units has reached unsafe levels again. It is generally accepted that there is a need to develop the bed capacity in Naas. Development of the unit would have the effect of both addressing the bed crisis situation and de-escalating acute levels by managing challenging patients in a more suitable environment. The Department of Health has provided sanction for £5.5 million funding to address some of the physical infrastructure deficits at Lakeview unit. This funding will enable a design team to conduct scoping and design work with a view to construction commencing next year and with a view to being complete by 2019. This will deliver an additional 8 beds, but also, most importantly, provide a high observation unit to alleviate existing pressures at the facility. I think the lack of appropriate step-down facilities in the form of high support hostels and community-based teams also has an impact on the ability of Lakeview to deliver the appropriate service. The Vision for Change would recommend up to 60 high support hostel placements for a population of this size, but there are currently only 27 places, so the HSE are looking at possible solutions to maintaining or to exploring the potential to increasing hostel support capacity within the area. Also, as part of the significant investment provided by Government over recent years to enhance all aspects of mental health service nationally, funding has been approved to recruit staff to populate 3 community-based mental health teams for the Kildare West Wicklow area. This will mean that more patients, as appropriate, will be seen at a much lower level of complexity and will reduce the requirement for admissions to the Lakeview unit, which is obviously where we, I suppose, want to take things moving into the future. There are at present challenges being experienced with the recruitment of psychiatric nurses to staff these teams, and work is ongoing nationally by the HSE to overcome acknowledged staffing difficulties. Just to ask the Deputy, and I say to reassure the Deputy that in light of the additional mental health funding being made available to the HSE for Lakeview, I will continue to closely monitor progress on this matter, and obviously will update the Deputy and your colleagues as this progresses. Thank you.
Thank you, Cancorla. Minister, I'm absolutely delighted to hear this news, and on behalf of the people of Kildare, on behalf of the people who use the services and their families, and indeed the staff in Lakeview unit, I think this is really, really good news. The fact that the physical design is going to be updated, the fact that this is going to be a brighter building, a better place for people to be treated, a better place for people to work in as well too, is very welcome, along with the addition of 8 new units. I'm really glad to see that construction will be commencing next year. If I could ask, maybe, is there going to be a disruption to the bed space while that work is going on? Because obviously there's going to be a 2-year period. So what are the plans for the interim? Also, I am glad to see the commitment in relation to the support of more appropriate step-down facilities, because obviously this has to be part of the holistic picture in treating mental health issues. The funding for the staff, I think, is really good as well too. And I just want to acknowledge the really good work that is done by Hope D locally and by the Samaritans, and indeed many other community groups who are really, really struggling with how they best can help support positive mental health in their own area, and particularly among young people as well too. So, but generally this is really good news and I welcome it. Thank you.
Thank you, Deputy Minister. To conclude.
Thank you. I suppose again just to say that I know your priority is that this additional funding is allocated, and really it's important that work progresses quickly but also in an effective and a timely manner. With regards to whether or not there would be disruption, my own view is that there won't, but I can clarify that for you. Obviously with the design team and the scoping work that has to be done, that will be included in that, so I can try and get that information to you. I think obviously in relation to the development of the service, we're asking at the moment, in a lot of cases, staff to work in, as you say, settings that are archaic. And really, if we're trying to encourage staff to come home, if we're trying to encourage nurses to actually go into the profession, we need to invest not just in them, but also in the facilities that they're going to work in as well. So this is going to form part of the work that we're doing to implement the vision for change as well. Obviously, on the other hand, the need to focus on our community-based services is extremely important. So obviously, making sure that those posts that have been approved, that they are funded, not funded, but they are filled as quickly as possible, is a priority for this government. But just to thank the Deputy, to reiterate what you have said, in that the staff and the community organisations and teams do a fantastic job, and really this is helping them and at the same time acknowledging the work that they've done and helping to support them as much as we can.
Thank you very much, Minister. That concludes item number 1. Item number 2 is from Deputy Michael Collins.